Welcome to New Life members, and thank you for joining this webinar. I'm Marcia Blackman, Project Coordinator for Milwaukee Life.
And I'm Kiara Simmons, Public Ally and AmeriCorps member here at United Way as a Community Health Ambassador. The goal of this webinar is to provide members with a history of the collaborative, data around infant mortality and prematurity, and the work of the collaborative today. At the end of this presentation, there will be information about how to get involved in Milwaukee Life.
Diving into the background of the collaborative, the Wisconsin Partnership Program, or WPP, selected United Way of Greater Milwaukee and Waukesha County to lead its Life Course Initiative for Healthy Families, or LIFE, in Milwaukee in February 2014 as part of a 5-year grant commitment. This allows United Way to expand its efforts to reduce Milwaukee's infant mortality rate by ensuring that Milwaukee has a sustainable community collaborative with multiple stakeholders. LIFE was designed to improve community conditions that lead to healthier birth outcomes among African American families in Kenosha, Milwaukee, and Racine. The Kenosha Collaborative is convened by Kenosha County Division of Health, and the Racine Collaborative is convened by Racine-Kenosha Community Action Agency. This slide shows the timeline of LIFE funding through WPP. The text in red are milestones for Milwaukee Life. Planning grants were awarded in 2010, which resulted in a local community action plan being released in 2012. In 2013, 11 program grants were awarded in Milwaukee, which focused on family and fatherhood support, peer and social support, group prenatal care, and research and evaluation. In 2014, United Way received collaborative implementation funding of $1.5 million across 5 years. After implementation in 2014, Faculty Director Dr. Deborah Ehrenthal joined UW School of Medicine and Public Health. Shortly after, the LIFE Program Office in Madison was established to facilitate regional alignment among the collaboratives and support regional statewide policy systems and environmental change activities.
The mission of Milwaukee Life is dedicated to improving community conditions that support healthy birth outcomes. Our vision is to eliminate the racial disparity in birth outcomes, ensuring that all babies blow out their first birthday candle. To achieve our vision, Milwaukee Life's goal is to reduce the city's infant mortality rate by 10% and the city's African American Black infant mortality rate by 15% by the 2015-2017 3-year period. This goal was set by the City of Milwaukee in 2011. In this slide, we've listed the goal rates of 9.4 and 12 respectively. We'll know if the rates are achieved after the 2017 data is released, which will likely be in spring 2018.
As we look at the City of Milwaukee's data, the infant mortality rate is calculated by the number of infant deaths per 1,000 live births. You can see that the most recent preliminary data from the City of Milwaukee Health Department from 2015 shows that there were 95 infant deaths, which means death before the first birthday, and 75 stillbirths, or fetal deaths. Overall, the infant mortality rate was 9.65. Breaking out the data by race, the African American Black infant mortality rate was 13.1, the white infant mortality rate was 3.6, and the Hispanic infant mortality rate was 5.6. This slide shows the 3-year rolling averages of infant mortality rates in the county from 1997 through 2014. The yellow trend line shows the overall rate. As you can see, the non-Hispanic white rate and Hispanic rate are generally under the overall rate, while there is a large disparity for the African American Black rate, which is shown by the red line. Although all rates are decreasing, the non-Hispanic white rate is decreasing at a quicker rate, so the disparity is growing. Taking into consideration the infant mortality rates by race, we'd like to break down those rates to show the factors of infant deaths. This slide shows cause of death overall and by race. In addition, the number listed as N is the number of deaths from 2009 through 2011. You can see that the numbers by race vary and reflect the rate trend lines. Looking at overall causes, about 58% of infant deaths are due to complications of prematurity. Around 18% are due to congenital abnormalities, and only 15% are due to sleep-related deaths, including SIDS, SUID, and sleep-related suffocation. Breaking down the cause by race, the percentages are similar. However, sleep-related death is around 7% less for African American Black infant deaths.
This image shows the factors that affect infant mortality and provides more detail on each factor. Factors in congenital abnormalities include genetic predisposition and a number of unknown factors. Factors in sleep-related deaths include secondhand smoke exposure, placing baby to sleep on their tummy, and unsafe sleep environments, which include bed sharing and soft objects like pillows or bumper pads. Prematurity, the lead cause of infant mortality, has a number of factors, including maternal age. Data shows that women older than 35 or younger than 17 are at higher risk for premature births. Chronic stressors, including poverty, racism, domestic violence, lack of social support, unemployment, and low education levels. Maternal health, including infections, weight, little or poor prenatal care, and chronic disease. Experiencing a previous preterm birth, poor mental health, and substance abuse. All of these factors can contribute to preterm births. Given this data, our action agenda is prematurity prevention, and looking at the data from the previous slide, you can see nearly 60% of infant deaths are associated with prematurity. Because of this, our greatest opportunity to improve birth outcomes is to focus on prevention and is in the best interest of the public. Data shows that in Milwaukee, the total cost for over 3,300 babies born prematurely in Milwaukee in 2009 through 2011 was over $216 million. This amount includes combined medical costs for the mother and child. With the $216 million spent on prematurity, you can send around 2,100 in-state students to UW-Madison for 4 years. This shows that premature births are a strain on our city and state's health care costs, and that we must work to prevent premature births.
The Milwaukee LIHF Action Agenda of Prematurity Prevention is centered on 11 priority zip codes, all of which have a 10% or higher prematurity rate. You can see from this graph which zip codes they are and how there is a marked jump from 9.2% to the 10.5% prematurity percentages. In 2016, the Milwaukee LIHF Collaborative identified 3 priorities for preventing prematurity: increasing awareness around the importance of pregnancy intendedness and birth spacing, because close interval pregnancies are a key driver of preterm births; supporting mental and physical preparedness for pregnancy, because unmanaged chronic conditions are a key driver of preterm births; improving social and economic conditions for communities at highest risk, because the chronic stress of economic insecurity, housing instability, and other social factors create a physiologic change that increases the risk of preterm births. The collaborative aims to advance local and state policies and practices around these 3 priorities. The collaborative is structured with a number of committees to implement the work of the collaborative. Mayor Tom Barrett and the City of Milwaukee and Wanda Montgomery of Children's Hospital of Wisconsin are co-chairs of the collaborative. There are communications and fund development support teams which provide support in the areas of media, public awareness, and sustainability for other committees and the collaborative. The 4 work group committees listed here each have co-chairs and are driven by their work group charges and work plans.
As mentioned, each of the 4 committees are tasked with carrying out implementation of the priorities and strategies of the collaborative. These committees report to the steering committee, which is responsible for advancing the direction, activities, and strategy of the collaborative as a whole. The steering committee is made up of all committee and team co-chairs, at least 8 community residents from the priority zip codes and ex officio members, which serve as content experts. Membership on committees is open to any person and organization. All committee members are considered collaborative members. We'll now share a little information about each committee. The Faith Roundtable is made up primarily of faith leaders and volunteers to engage in efforts to reduce health disparities through a series of projects designed to increase food security, economic security, and heightening awareness among membership. Past projects have included Sow and Grow, which is a church-based gardening project, a youth leadership summit, and engagement in strong baby sanctuaries. The Healthcare Access Committee's goal is to expand access to high-quality health care over the life course for African American families in the target Milwaukee zip codes. The committee has identified 3 strategies, which include connecting high-risk women to primary interconception care, connecting women with mental health or substance abuse disorders to behavioral health resources during prenatal and interconception periods, and lastly, piloting and evaluating the One Key Question clinical practice standard in primary care clinic settings serving target zip codes. All of Milwaukee's major health care systems serve on this committee, along with 3 federally qualified health centers and various other health care stakeholders. The Policy, Systems, and Environmental Change and Social Determinants of Health Committee, otherwise known as PSEC, are focused on advancing achievable policies, systems, and environmental change that will prevent or reduce prematurity. They also work to improve conditions through equitable policy change that directly address social determinants of health and healthy birth outcomes, and to increase community capacity for advocacy. They have educated officials at the state and local level about policy change and are responsive to other work group committees' needs around policy, systems, and environmental change. The Strengthening African American Families and Fatherhood and Male Engagement, or otherwise known as SAFME Committee, works on addressing the racial impact of environmental stressors that contribute to premature births and infant mortality. They also monitor and support existing fatherhood and male engagement efforts in Milwaukee, while supporting efforts to improve the status of women's health in African American communities. Their strategies for implementation include convening fatherhood and parenting programs in the city for a community of practice and work to align the work of existing programs working within African American communities.
As mentioned at the beginning of this presentation, United Way serves as the backbone or convening agency for the Milwaukee Life Collaborative. The committees that Kiara described serve as action and implementation for the collaborative, while we, as the backbone agency, aim to maintain and advance the process of the collaborative. This slide lists the goals of the backbone agency, which include maintain the functioning of the collaborative, engage programmatic grantees of life and healthy birth outcomes, support regional engagement, guide action agenda vision and strategy through guideline documentation and process, advocate and advance policy, systems, and environmental change, integrate data and embed evaluation into process and outcomes, build sustainability, and build public will through community engagement. The backbone structure is informed by the Community Coalition Action Theory, which is modeled on this slide. Essentially, the backbone agency and collaborative membership infuse process, structure, resources, and engagement to lead to implementation. Implementation and assessment of strategies are designed to lead to community-level change and outcomes. The Milwaukee Life Collaborative is also informed by collective impact, which requires a common agenda, shared measurement, mutually reinforcing activities and action, continuous communication, and a backbone agency. Milwaukee Life Collaborative is staffed by 3 full-time United Way staff: the director, the healthcare access project manager, and the project coordinator. Providing additional support are public allies, which serve as community health ambassadors for 1-year terms. Overseeing staff is the vice president of community impact at United Way.
The public awareness arm of Milwaukee Life is Strong Baby. This campaign was first introduced by the City of Milwaukee Health Department in 2010. Milwaukee Life launched a new Strong Baby campaign in 2014, which included a casting call. In 2016, a campaign focused on the health department's home visiting program was launched. The Strong Baby campaign is designed to engage the community around the importance of community conditions and how those conditions can lead to stronger babies.
All of the action and strategies of the collaborative are made possible by membership in the collaborative. Collaborative members are responsible for outcomes to improve community conditions that lead to healthy birth outcomes. We ask members to use expertise to support, advocate, educate, share, and advise the collaborative. There is no term limit to membership, and members will be asked to recommit annually. Membership is open to any individual or organization by watching this onboarding webinar and completing a membership form, which is available online. Members may end their membership at any time in writing and may be removed by just cause by consensus of the steering committee. If a collaborative member resigns or is removed and represents in part or solely as a representative for an organization, the member should provide a recommendation for another representative of the organization to serve on the collaborative. There are 4 primary membership options. There are members that participate in quarterly convenings only, and members that serve on committees. Additionally, there are other opportunities to participate. For example, adding Milwaukee Life information into organizational newsletters, website, or other media, or serving as a link to specific populations, or by offering meeting space. Lastly, there is an option of inactive membership for individuals that are included in our mailing list but do not participate in other ways. In any option selected, members receive a monthly e-newsletter and invitations to quarterly convenings. All of these options are offered and listed on the online membership confirmation form.
This slide shows dates, times, and locations for 2017 quarterly convening meetings. All of the quarterly convenings are open to the public and are an opportunity for members to network and discuss the direction and strategies of the collaborative. RSVP information is available on the United Way website under Events. Thanks for participating in this webinar. We hope you've learned more about the history data around infant mortality and prematurity and the work of the collaborative.
To add or confirm membership, please complete the online membership agreement and information form at www.unitedwaygmwc.org/Milwaukee Life Course. If you have any questions about membership or the Milwaukee Life Collaborative, please contact me at 414-263-8154 or at mblackman@unitedwaygmwc.org.